Welcome to the Compounding Center Connections, where we talk about different health conditions with our partner practitioners. I'm your host, Jay Gill, from the Compounding Center in Leesburg, Virginia. I'm a compounding pharmacist where at the Compounding Center, we collaborate with practitioners, create custom medications, and help our patients get better. So in this episode, we have Dr. Melissa Delgado, who is returning for another episode and is going to talk to us about chronic pelvic pain and ozone therapy. So Dr. Delgado, you have a practice, the Chronic Pelvic Pain Center of Northern Virginia in Tysons, Virginia. Could you share a little bit of your background and introduce yourself to the listeners and viewers?
Yeah, thank you so much, Jay, for inviting me on. This is always such a treat and so much fun. And I love having conversations with you about the things I'm most passionate about, which is pelvic pain. So I'm trained as a OBGYN, and I segued into chronic pelvic pain over a decade ago. I did have some training in it, which was really amazing, but I really niched out and focused on pelvic pain because I saw there was a great need for women who are suffering from pain, and we just don't have bandwidth in a regular standard general OBGYN practice. And so I decided to really dedicate my time and my life's work to just dealing with this topic. So it's uber niched out, and it's just amazing how many women actually suffer from pelvic pain and its overlapping conditions. So, that's what I do. I'm at Tysons, and it's a highly customized environment. So we can start with a protocol. Like, you have done so many amazing compounds for me, but as symptoms improve and as women get better, then we need to adjust maybe the supplements that they're taking or what they're doing. And we can customize that because I created a safe environment for women to kind of tell their story and then, outline a path, and that can change at any moment, which is what I love to do.
I so agree with you. There's so many women out there with this condition, and it's been a pleasure to partner with you and learn so much of what you do and how much you help these women. So before we dive into this, I just want to have a little disclaimer that, this is information discussed today is really for informational purposes only, not meant for diagnosis or treatment. So you said this is such an uber niche, a chronic pelvic pain. Could you talk to us about what is it and how common is it?
Yeah. So when we think of pelvic pain specifically for women, we think about the pelvis or the lower abdomen. And so any pain lasting greater than 6 months, which is not a very long period of time, if you think of it, if you have a cycle every month, it really is amazing that it's just a consecutive and the experience of pain just gets worse over time. So we see women with endometriosis, bladder issues. A lot of women don't connect pain with bladder. And why would we, right? Like we just think, oh, it's my uterus or my ovaries. But really, interstitial cystitis, chronic UTIs really contribute a lot to the pelvis and pain related to the pelvis. And then when you think about the GI tract as well, women a lot of times have constipation, and then pelvic floor. So your musculoskeletal, you're thinking women that have painful intercourse, they might have nerve pain called pudendal neuralgia or vulvodynia. Most women research vulvodynia, they understand that. And then there's a mental health component as it relates to anxiety and depression that gets upregulated from the pain. And then trauma is another aspect of pain that I want to tackle next year, and bringing in some healing as it relates to trauma. And women with pain we know have significant amount of trauma that may not be fully addressed, and that really helps the healing process. And when I started doing the numbers, it was amazing to me when I started thinking, okay, women are in pain, 2 to 3 weeks out of the year. It takes several years to get to me. We're talking about 1,000 days of pain these women are in if they're 4 years into any kind of these overlapping conditions. So it's really impressive. And, the number keeps going up, but if we think globally, women 190 million, and then, here where, the common estimated average women who experience pelvic pain is 25 million. So it's a huge number.
So, that right there tells me why you decided to kind of carve and just focus on chronic pelvic pain. You just can't manage as an OBGYN, these this numbers of people affected and do regular OBGYN too. So
Yeah, it's the
quite
time
impressive.
commitment. Yeah, you really need to spend time. My first visit's about an hour, and then the follow-up visits. And the good news is people can heal from this. We just have to be, or sort of collaborative in our approach, and have a really good vetted network, which we do here in Virginia. I mean, there's always people would love to have in our network, but
Yeah.
now with telemedicine, I think there's more access to people not necessarily in the state that do some work and contribute. And we're really trying to gain traction as it relates to endometriosis. But since I deal with all of the overlapping conditions, we're like, the group who deals with pelvic pain and all those things, the physical therapist, the trauma therapist, everybody, the GI, urology, everybody on the team really has, a special interest in just really dealing with pain, which is different from an acute situation. It's really a chronic, ongoing inflammatory response. So that's how we have to address it.
So talk to me a little bit about how you this we're gonna talk about pelvic pain and the ozone. And ozone, I'll be honest with you, is new to me. And how did you come about ozone? How did you incorporate ozone with this therapy?
Ozone's an amazing modality, and honestly, I was introduced to it by other providers that in the area that work with Lyme, and they're like, "Oh, have you done ozone therapy?" And I had no idea what it was, so I had to look it up, and I was like fascinated by it. I'm like, this is something that could really change my practice and move the needle as it relates to pelvic pain. And really it started with trying to help women get control over the bladder and interstitial cystitis. And when I went to take the course, I was just blown away by how amazing this modality is. And it's very simple, and it's not so expensive. And it's a gas that's derived from oxygen. So it's 3 atoms of oxygen that creates ozone. And so the sad thing is, a little history about it, is that it's been around for over 150 years. And it's been used in the medical community in like the 1800s. Nikola Tesla actually patented the first ozone generator in the United States. So it's been around. It was well vetted. There's a lot of theories about why it's kind of it was taken out of circulation in the medical community. But when I did some research on this before I brought it in, it's an overwhelming amount of literature that ozone has. It's like 11,000 published articles now, and a lot of them are on
Wow.
PubMed. There's an American Academy of Ozone Therapy. So there are thoughtful and mindful ways to use ozone. It's not scary. It's like anything else. If you get trained and you know how to utilize the modality, it's extremely powerful for chronic illness. And that's where the Lyme, providers got hooked into it, because you see amazing results, because it's a fascinating subject to get into when you start dealing with oxygenation, how we heal, how disease actually starts. I think we don't know that as robustly sometimes when we're like deep in the weeds of learning medicine, and it's really back to physiological basics of how the body works. And we really it runs off of the idea that we need oxygen to maintain our health. And
So,
a lot of the process, yeah, go ahead.
no, I didn't mean to interrupt. I was going to say, so explain to me. I'm aware a little bit what conventional medicine approaches chronic pelvic pain. You know, whether it's muscle relaxants or PT. You know, you're
Yeah.
referred to PT. So, in your practice, how do you incorporate the ozone with some of the conventional therapies out there? Uh,
Yeah, that's a great question. I use it more and more every day. So I use it every day for GI symptoms, anywhere from leaky gut all the way up to ulcerative colitis and Crohn's. Now, I don't see a ton of patients with ulcerative colitis, Crohn's. I usually see people in the leaky gut, IBS type spectrum, which overlaps more consistently with what I do. But for the bladder, it's amazing. And I'm rolling out protocols for endometriosis. So the way that we can get the gas into the body, I think, is what a lot
okay.
of people kind of ask. And so in my realm, we use what's called insufflation. So we can put the gas directly into the bladder, directly into the rectum, and then
Uh,
directly into the vagina. So you have a generator and you drop the gas from medical grade oxygen. And it's a converter and it denatures the atoms and it recombines as O2 and O3. So oxygen and ozone. And ozone has a really short half-life. It only lasts about 40 minutes. In open air, it'll go convert back to oxygen. So it's unstable in that sense. So you have to make it and utilize it, fresh and when the patient is there. You can trap it in oil. So a lot of people like topical for like dermatology, and you can trap the gas in ice. So some people use the ice cubes as well. And then you can use water. So there's a lot of people who drink it and use water irrigation. So in the dentistry realm, they irrigate the mouth with ozone when they're cleaning. There's a lot of evidence to decrease inflammation and gingivitis in dentistry.
uh,
Veterinary medicine uses it. The ortho community uses it for joints, for regeneration, which it's amazing for. So, you can use ozone in so many different ways. There's also sauna, MAH, which you mix the ozone with blood, and you kind of, it's anticoagulated blood, and then you place it back in the body through IV. And that's where that comes from, the Lyme community and anybody with chronic illness. The IV ozone, not direct IV, but through MAH, is where a lot of patients get benefit from.
so, Dr. Delgado, can you explain how is ozone considered a regenerative therapy? Can you explain that a little bit?
Yeah, so a lot of times, so ozone in general, people say, well, what is it good for? How does it work? Right. And
Yeah.
it leads to a cascade of physiological events in our body. So the net of that is it uh, can inactivate bacteria, viruses, fungi, yeast, protozoa. So people have a lot of times infection as it relates to inflammation. It stimulates oxygen metabolism, which we need to maintain health. And a lot of our bodily functions depend on how well oxygenated we are. And then it activates the immune system. So it helps our own body kind of replenish our own immune system, which helps then address an infection as well. And then for the regenerative part, it actually releases growth factors, which helps that cascade go. So it's good for degenerative joint and any kind of joint disease. And then for the pain aspect, which is where I was fascinated with, is it decreases or eliminates pain by action on pain receptors itself. So it's just a fascinating tool to use, especially when we don't have a lot of options, as you know, when we're treating chronic pain anywhere, right, in the body.
Now, so does a person get pain relief after the first treatment, or does it take multiple treatments? Um, what do you usually see, or what's your protocol? Approximately how many treatments does it take?
Yeah, that's tricky. That's where like the individualization comes in. If
Okay.
someone just has, let's say if we're using it for interstitial cystitis, if they just have bladder issues and they don't really have underlying Lyme or mast cell or MTHFR, other chronic illnesses that sometimes impede healing, they may not have an exacerbation of symptoms after the first time. Sometimes that happens where they experience a little bit of for just what people know it as die off, where if you're having these inactivations of microbiome, sometimes you get an exacerbation of whatever symptoms you experience, like urgency, frequency. Sometimes pain gets a little worse, but then it gets better. And with each ozone application, you get, and as the body heals, it's cumulative. So everything gets better over time. And so you have to kind of adjust the ozone and the protocols based on the feedback that the patient gives. So if they tolerated the first ozone session and they're feeling great, then we increase the dose as we go, and we have a little protocol for that. And if they're not feeling so great or the flare lasted for more than 2 days, I kind of either decrease it or stay the same and kind of evaluate what else is going on and how we can optimize it. But you typically, 10 sessions is where we start. And that's because most of the time inflammation is decreased after 6 to 8 weeks. So that gives them some time to know and learn, okay, this is much better. It's been 10 sessions. And then where do we
Yeah.
go from there? Do we space them out? Do we not need ozone anymore? Do we then segue to supplements? Like how do we address it? What else is going on? So yeah, it can be dynamic. But eventually with time, you will get there.
Gotcha. So, is there does everybody able to get ozone, or is there somebody that is not a good ideal candidate? Like, is there anything that disqualifies them from ozone therapy at all?
Yeah, I think if people had ozone in the past and didn't really resonate with them, or maybe they were
Okay.
given too much, you might just have to do baby doses. But there are some people that don't respond great, and that's a lot. That's a lot with the Lyme community. I see a lot of Lyme patients. You have to go really low and slow with them. But from the literature and from the coursework, pregnancy, we don't usually do ozone in this country. Anyone who's on an ACE inhibitor, uncontrolled hyperthyroidism, but if they're on medication, they're controlled, it's usually fine. Thrombocytopenia is another one, and like G6 PD deficiency. But those are really the only ones. Ozone is generally safe and well tolerated. And what's nice is that we have robust literature from the European data as well. So there's a lot of countries that utilize ozone. We know it from cleaning drinking water. So I know in Paris and abroad, they use ozone for in the water industry to clean the
Oh,
water
yeah.
filtration systems. That along with UV light. So we know it's really good for microbiomes. And I think that's where a lot of the work started, is to get infection and chronic infection under control.
If somebody wanted to kind of hearing or watching our podcast, wanted to read or get to know a little bit more about ozone, is there a reputable website or where they can go and read and become a little bit more knowledgeable about this therapy?
Yeah, you want someone who's been trained in ozone as well, I must say.
Okay.
And there's the American Academy of Ozone Therapy. I think Dr. Frank Schallenberger does a great job of educating the public. He has a book called The Principles and Applications of Ozone Therapy, and it's a small book and it's really easy to read. He wrote it for patients, so it's not too difficult to understand.
Okay.
And then yeah, he has a website as well. And then PubMed has a increasing app amount of literature that you can look at and get more educated. Hopefully I will have this stuff coming up on my website as well. That's my goal, is to have more information about this because it just works so well. And I mean, basically Ozone, typically it just helps correct the underlying tissues, and the healing results are long-term.
Well, I'll make sure that I include the information that you just gave me in the show notes about Dr. Schallenberger and the organization. Now, one last question. Are the results that you get from the ozone therapy long-term? Is there relapse and you have to go through it again? Could you talk to us a little bit about that?
Yeah, I think the effects are long-term depending on what you're treating. So for interstitial cystitis, there are long-term benefits, and the thought is you can be symptom-free for many years. We typically don't say cure yet for IC. We still don't understand how that happens. But those that deal with Lyme see much benefit for long term. And then for the GI tract, I feel like once you correct the underlying issue and you really correct the microbiome and the inflammation with ozone, you're good for a long period of time. It's just it's the GI is tough because of our environment and our food sources and stuff like that. But a lot of people maintain with ozone. There's ozone suppositories that you can use that some people are like, oh, we'll just do a rectal ozone suppository once a week, once a month. I mean, just to maintain part of their prevention. Once you get to the prevention stage of your health. I know a lot of people that maintain with that. I do. I mean, I use ozone at least once a month. Some version of ozone I have in my life, and they sell ozone capsules that you could take orally, and a lot of people tolerate that well. So you just kind of build it into your your healthcare routine, and it really has very minimal side effects.
Okay. Well, Dr. Delgado, thank you very much for joining us today. You shared a lot of good information with us. And how can someone reach out to you or, find out about your practice?
Yeah. So our phone number is 703-448-6070. And our website is pelvicpaindoctor.com.
Well, thank you very much. I'll make sure the contact information is in the show notes. And thank you, everyone, for tuning into the Compounding Center Connections podcast. We hope you found this information presented today to be helpful. If you have any questions or comments, please feel free to reach out to me at jay@compoundingcenter.com. Subscribe to our YouTube channel and our podcast channel, The Compounding Centers. Stay tuned for future episodes.
Thank you.